Greetings to the audience of the program. We are in this together. My name is Diana Medina. I'm the Regional Community Engagement and Accountability Manager for the International Federation of the Red Cross and Red Crescent officer in Panama for the Americas region. And today we had a very special guest in our show. Our guest is Dr. Pedro Porrino, epidemiologist, and with him we are going to address the topic about the vaccine, COVID-19 vaccine, which has been in the media all over the world, the discussion about this new this new vaccine or new, I would say vaccines in plural, no? Because there are more than one. Welcome, Pedro. Thank you for accepting this invitation today.
Thank you very much, Diana. A real pleasure to be here.
As I said before, in recent weeks, we have been seeing information in the media about at least 2 new vaccines that are being announced that they are ready, no? And with the necessary studies to begin mass production, etc. Could you tell us if we do really have a COVID-19 vaccine right now?
Well, let's say the first answer is no. We don't have a COVID-19 vaccine yet. It's true, as you said, that we have 2 laboratories, 2 vaccines that are very, very advanced and at a very advanced development stage. That doesn't mean, are at very advanced development stage in terms of investigation, research, and clinical trials. But from there to have the vaccine on the counter, over the counter, it will take some time. Actually, yes, you said that we have 2 vaccines or 1 vaccine or 2 new vaccines. Actually, I would like just to ask, or I ask the audience to think, okay, how many vaccines maybe there, right? Just guess. Maybe people say, no, I have heard that maybe there are 10, 12, 20, 30, or even just some people can guess, almost 100 vaccines. Well, I will tell you, we have now, according to WHO vaccine development portal, recorded there more than 212 vaccines in development. Out of these 212 vaccines, we have 48 in clinical phase. Clinical phase means that the researchers, the laboratories working on these vaccines are already testing the vaccine in people. Actually, the clinical phase has 3 stages, phase 1, phase 2, and phase 3. So each phase implies that I can test the vaccine in more people, in a larger population, because all the results from previous phases encourage me to do that, and also are saying that are safe enough to go ahead. Out of these 48 vaccines that we have on clinical phase, only 11 are in phase 3, meaning that they are being tested in large population, more than thousands of people. But, phase we need to keep. So out of these 11 vaccine in phase 3, these 2 vaccines that you mentioned that are on the newspapers, are on the media, are the most advanced. So actually, they are already reporting very positive results. They are providing with a lot of details about safety, about immunity produced by the vaccine. But all the information that we have so far is provided by the laboratories, by the people who are developing the vaccine. After that, whenever they think that the vaccine is ready, need to be assessed and need to be checked by an independent body of experts and researchers in order to check that objectively, whatever the laboratory has said is true in terms of safety and in terms of efficiency or effectiveness, right? And only then the laboratory will get the authorization to produce the vaccine to be distributed in the market. So it's true that we have at least 2 laboratories, 2 vaccines, quite advanced, very advanced, but from there to have that in the market, we have still some time ahead.
But how does vaccine will work if they are already done and we had access to them? How they work?
Okay, basically, all the vaccine work in the same direction. What we aim with a vaccine is to produce, to trigger an immune response by people who receive the vaccine, right? So just the point is to produce an immune response. So I need to make the immune system to respond, to launch an answer and to produce antibodies against just the pathogen. Basically here, the vaccines are using 4 techniques, 4 different techniques. The first technique is like the traditional one. The traditional one is just I get the virus, in this case, the COVID-19 virus, the SARS-CoV-2, and I modify, I weaken the virus, I make a virus an inactivated virus, and I put that inside the body, inside the host, in order to identify, my immune system identify that there is something that is strange, that is not belonging to my body, and then I just develop an immune system. That is the first and is like the most traditional way of producing vaccine, and the most of vaccine that we have in the market in somehow have used this technique. The second technique is that instead of inoculating, instead of producing a vaccine with the whole virus inactivated, what I do is I take a portion of the virus. In this case, the most of the time, a protein that also I have, through research, previously identified that is a key protein in the triggering the immune system, in launching the immune response. So just in this case, also like for the inactivated virus, there is no any possibility of getting infected, because what I am doing is just introducing just only a portion of the virus, a protein, and then I just trigger the immune response. And the third and fourth technique that they are using are the most novel and are the most advanced. The third is to use a modified, let's say, laboratory virus, a different virus, but I have just modified in the lab in order that this virus is totally harmless, cannot produce any problem, any infection. And I use that virus for producing a protein and just belonging to SARS-CoV-2, to the virus of COVID-19, in order that my immune system just develop a response against SARS-CoV-2. And the fourth technique, that is the technique that these 2 labs that are the most advanced in terms of developing and having ready a vaccine are using, is that they are using what we call just mRNA or messenger RNA. And then what they are doing is that through the vaccine, they are inoculating just the genetic code of the virus in order that our own cells produce that protein, and based on that protein, we just develop the immune system. So it's a little bit complex. There is some technicity here, but basically, and in a nutshell, the point here is just, regardless the technique used, I am looking for generating an immune response from my body.
Excellent, Pedro. Those vaccines will be safe, because many people will be thinking, well, this being developed so fast, those vaccines are going to be safe for the people who get shot?
Well, all the vaccines in the market are extremely safe. Why? Because, as I explained, they have passed through a huge mechanism of controlling, safety regulation, evaluation by independent expert. So with COVID-19 vaccine is not different. I understand that people can wonder, well, but usually maybe people have read or have heard that a vaccine in average can take even 10 years to be developed, since the first phases of the development of the vaccine till the vaccine is ready in the market can take even 10 years. So how is possible that the COVID-19 vaccine is taking no more than 1 year in the best scenario? Why? Because we have been in so rush that we don't mind about safety, or because of whatever? No, it's because what is new in the process of COVID-19 is because there are so many people working at the same time, totally focused. There is a political commitment and a scientific commitment just to develop this as fast as possible. We are developing many phases just parallelly, but phases that can be just developed parallelly. But despite of that, the same regulation, the same controls, and the same safety mechanisms. So that means that whenever we have a COVID-19 vaccine, it will be as safe as any other vaccine in the market.
So who should get those vaccines? Who should be, because, well, of course, at the end, all of us will get the vaccine because it will be necessary for all of us. But at the beginning, who should take it?
Well, it's a very interesting question, because also and I think that is a key message, just to say that even when we have this so expected announcement saying that this is the vaccine of COVID-19, and now just is in probably not in the drugstore, because it will be distributed through just the public health system and things like that, but say, okay, yes, you can go to the health facility, you can go to the primary health center to get your COVID-19 vaccine. We won't have vaccine for everybody. Actually, just to control the transmission of COVID-19, we will need between 70% and 80% of the entire population vaccinated or with immunity to control the transmission of COVID-19. So just at the very beginning, we are not going to have billions of doses for every people. So that means that we need to prioritize. There are now committees trying to just make a solid and sound statement and protocols and to give guidance about who should get the vaccine first. And all these committees at this stage are agreeing that basically we have two groups that should be vaccinated first. One is the group of the most vulnerable people, meaning just aged persons, because we know that the risk is associated with age and with pre-existing or diseases, or you know, just like cardiovascular diseases, metabolic diseases that are putting all these people at a higher risk of not contracting, not being infected by COVID-19, but developing a much more severe clinical condition. And the second group is the health staff, the health personnel who are in close contact daily with people infected by COVID-19. So the risk of getting infected is much higher, and also we need to protect them because we need them to keep providing medical care, and not only to COVID-19 patient, but every patient.
So it will be necessary that we continue using the protection measure that we have been using for
yes.
9 months or 10 months right now, no?
Yes, and this is, thank you, Diana, to raise this, because it's a very, very important message. Also, just we cannot confuse people, or we cannot lie people. So just the issue of having this vaccine today doesn't mean that tomorrow everything is over. Why? Because we need, as I said, between 70 and 80% of the population vaccinated with a good immunity. Actually, just we need still just to determine just for how long this immunity will last, whether or not I will need a boost doses in some years. So just we will have still ahead some time in which, at the same time that we are vaccinating people, we will need to keep all the public health and social measures, because the risk of getting infected will remain there. And so we need to keep protecting ourselves and protecting the most vulnerable people till at least they can be protected. And that will take for some time.
Thank you very much, Pedro, for this interesting information
welcome.
You have shared with us today. And thank you to our audience for joining us. And we invite them to stay connected through our social media channel, where we will continue, of course, addressing that kind of interesting information that regarding the pandemic. And we also invited our audience to share your doubts, questions, and comments using the chat of these channels, and we will be very happy to address your question in other show in the coming days. Thank you very much again, Pedro, for joining us today, and we will see you soon for sure in another show.
Please, it will be my pleasure. Thank you very much.